Yeah, we are live. Please proceed, doctor.
All right, everyone, we're back. We were just doing the webinar and we got cut out in the last couple of slides. So I just wanted to finish it off because we were at an important section talking about the solutions. And for those of you who are joining right now, our topic is on the mouth COVID connection and how IL-6 levels, poor oral hygiene, bacteria from our mouths can exacerbate and make COVID worse and lead to higher chances of respiratory complications and ventilation. So some of the solutions that we were talking about are good oral hygiene, like for example, povidone iodine rinse. Okay, there was a study that was just released that shows if you put a couple of teaspoons of it in a cup of water, or in like a 3/4 full water, you can kill entirely COVID in the mouth. So again, iodine or betadine. Put it in a cup, a little bit, rinse, gargle with it, and spit. Also, the company also has a nasal spray, a betadine nasal spray that you could spray into the nose that will help reduce the virus there. Also, we talked about, again, the brushing and flossing and how to floss earlier. But as far as the cleaning, again, this is not the time to do your very simple prophies. This is the time that you get the patient numb in certain areas, go in for a nice good scaling and root planing. This is a time where you want to get your probe, maybe a neighbor's probe, check for furcations, check for any bacteria, check for any, maybe use a CT scan so you can see if you find any lesions, periapical lesions near the sinus. Again, these lesions, most of them are asymptomatic, that most of them are not causing any pain. So we want to be proactive and preempt that bacteria from entering into the system. And when a pocket, after a scaling and root planing, when a periodontal pocket is 5 millimeters or more, is when you want to refer to a periodontist. And again, some offices are very good about referring, some aren't. This is a time when your patients will value you more if you're proactive. And I think you might have some stuff going on in the bone, and you show them in the X-ray that they have some fuzzy area, some gray area that's interproximal of, let's say number 20 and 19. Let's have the periodontist check. He might need to go a little bit deeper than where myself or the hygienist can get to. So that's key. Also, genetic testing that we just talked about, so checking the IL-6 risk level. But how about we find out what the IL-6 is in their blood right now? So they can maybe go to the doctor and get their CRP checked, get their IL-6 levels checked. If it goes above 80 is when it goes on they go on a ventilator. Let's check to see where they are right now. No one's talking about that. If IL-6 is the predictor for ventilation, if IL-6 is what causes people to go down into this cytokine storm, let's find out. Let's see where your IL-6 levels are at today. That's it. You can do a blood test and find that out. The next thing is for people who don't want to come into the office very easily, virtual consultations and mobile dentistry. So I know I'm a big part of that solution. I advise for Dentulu, a tele dentistry app, which they have a lot of amazing things in the pipeline, the solutions. So, talk to them, talk to your patients at home, give them some advice. And then sometimes in life, in order to make something happen, you have to take baby steps. So you start with, a phone call over the phone or face-to-face, get them comfortable. Then next thing you know, they come in. And next thing you know, they become a patient for life. The next thing I want to talk about that, again, people don't talk about too much as far as in dentistry, but this is what I was talking about when I say our role is going to change. I talk about diet and vitamins with almost all my patients right now. Because they say, Doc, what do I need to do to not die? I say, let's reduce inflammation. How do I do that? Maybe steroids, maybe inhaler, if they get COVID. But to preempt it, obviously, decreasing it in their mouth. And then lifestyle. How about you decrease the inflammatory foods that you're putting in your body? You know that meat is inflammatory, chicken's inflammatory. We know that turmeric is anti-inflammatory. We know that sugar, literally sugar and processed carbohydrates increase IL-6. So again, they should know that. Sugar is one of the worst things that you could put in your body. Not fruit sugar, not the one that's in fruits, but sugar that's processed sugar and processed carbohydrates increase IL-6. These are the vitamins I'm recommending my patients to take. I tell them to take vitamin D3. Vitamin D3 is very good for the immune system. It's very good for when people get COVID and to help the immune system when you get COVID. I like a nice strong dose, like 5,000 milligrams a day. If they get COVID, I'll tell them increase it to 10,000 milligrams per day. Vitamin C, at least 2,000 milligrams of vitamin C a day. And up to 3,000 milligrams of vitamin C. Zinc, as we all know, zinc is very important. In fact, many of the drugs that they are giving to the patients, it requires zinc to fully work, like hydroxychloroquine, Z-Pak. It's a part of like the remdesivir. There's multiple medications in different countries that are being used, and then of course turmeric. As far as there's garlic. Garlic is very anti-inflammatory. Onion is anti-inflammatory. Ginger is anti-inflammatory. This is the time to be taking those. So the take-home message is overall gum disease. So our study is finding a definitive link between COVID-19 complications and chronic gum disease. And gum disease can make lung disease worse. Inflammation in the gums can be silent and contribute to body's overall inflammation. The bacteria in the gums travel through the body and spreads this harmful inflammatory IL-6 protein. And you got to use those words when you're talking to the patient. It's a harmful inflammatory protein. And when IL-6 levels are high, it is a predictor. It predicts respiratory failure and a 22 times higher chance of putting patients on a ventilator. And COVID-19 is more serious in the presence of inflammation. Poor plaque control can negatively affect the lungs of hospitalized COVID-19 patients. And with that, I think that dentists should be getting even in the hospitals to check people's gums. Because if it's the hospitalized patients that are at the most risk, why not get a cleaning while they're there? It's time for the doctor to step up, the dentist to step up and show our value and show that we're really, we're part of the solution and we're part of the overall solution. The mouth and the teeth and the gums are an organ, just like any other part of the body. There's a blood supply that's the same blood that reaches the foot in 1 minute. We need to think systemically, comprehensively. Again, that's my mission moving forward, the goal, and again, the take-home message, which we kind of went over, but again, these are just I went over those already. But we are taught to analyze body systems and parts separately and to change one area at a time. Such approach often ignores the interconnectedness of the systems in the human body. And it's time for that to change. So thank you everyone for listening to this presentation. Again, this is the quote. Thanks for listening. You can find my email and my information. You can contact me, and thank you.
Yeah, Dr. Molayem, thank you so much. For those who have further questions and really want to get this message out, I invite you guys to email Dr. Molayem at smolayem@gmail.com. You will undoubtedly hear more about this over the next several weeks as more and more organizations disseminate this information. I think your point is really well taken, Dr. Molayem. I was sharing while you were off stage while you're offline is that we need to now find new innovative ways to get to our patients. For some of our older dentists that aren't returning to work, they can still do they can still maybe send some of these kits and actually do the testing remotely. They can do the a diagnosis virtually after the results are received. I know Oral DNA is one of several companies that offer the testing kits, but taking a more proactive approach, and other dentists who might want to do some of this work on site. We are at the front line. And if they want to take their dentistry and mobilize their dentistry and go into the hospitals, into the patient's home, into the senior living centers, I think now more than ever, it's time to really re-emphasize how important the oral health is and what a direct connection it has to the rest of the body. So thank you. Thank you for sharing your message, and we look forward to hearing from you again. And we're all proud of you. Thank you for all the hard work that you do and that have you been doing for the last decade. So thank you again for all our viewers, and we'll see you next time.
Bye.
Bye-bye.